Right. Good evening, all, and welcome to the community conversation on the Black community and the COVID-19 vaccine. I am Tiffany Ward. I am the Director of the Office of Racial Equity and Social Justice and the county's Chief Equity Officer. I'd like to welcome you all to tonight's conversation. Tonight, we are joined by a few of our elected officials, as well as local and national health officials and who have helped us navigate this public health crisis. Just in May and June of 2020, I was doing a panel much like this, except for the topic was COVID-19 and the prevention of its transmission, as well as testing and contact tracing for the COVID-19 vaccine. But tonight, just less than a year later, we're already talking about the dissemination, the safety, and the effectiveness of a vaccine. I know sometimes it doesn't feel like it, but we are making quick progress in our fight to conquer this virus. So I'd like to introduce our first panel, which is our panel of elected officials. We are joined here tonight by our County Executive, Mark Elrich, by our District 2 Council Member, Craig Rice, and by at-large Council Member, Will Jawando. County Executive Mark Elrich will be the first to give us opening remarks tonight. Mark?
So welcome everybody to this meeting, and I'm glad I could join you. I wish we were getting together to discuss a happier topic, but these are necessary discussions. And we are truly still in the midst of this pandemic. The end is, I hesitate to say the end is in sight. I think we know the path to getting there. But in the meantime, we need more vaccines for sure. And we need systems to be able to deliver them, and we need to be able to deal with the variants that are coming down the road. So we remain in challenging times, but again, it is hopeful at least that a year later we have vaccines. I was thinking about Tiffany's comment about a meeting last year, and I was thinking in May we were still discussing whether or not we'd be open for the 4th of July. And we were talking about relaxing requirements possibly in the middle of June in order to have the 4th of July celebrations. And the 4th of July came and went, and lots of other things came and went along with it. So we are still here, and we're in this new phase of vaccines. Last summer when we were doing the work and trying to reach out deeper to the communities, one thing the county realized was that our traditional means of reaching people simply wasn't working when it came to minority communities. And the Black community was, definitely not getting tested at the rate that we had hoped they would get tested. And testing was very important in terms of identifying where the virus was and affecting our ability to control its spread. And so after a while, we came to the point where we decided to increase our reliance on community organizations in order to bring the message about testing deeper into the community and to get the community more involved. And here we are now in February, a good 8 months later, and we're having this discussion again about how do we get the community more involved and how do we run a vaccine program that's equitable. Equitable distribution has been one of the focuses of our public health team in this county from the very beginning. The county is committed to making sure that all of our communities have equal access to the vaccine. We're well aware of the disparities that come from language barriers, that come from technology barriers, from computers that don't stay online long enough to complete a form, or computers that are slow. We're aware of barriers in terms of communications and the absence of, a newspaper in the county anymore that covers local news and catch as you can news reports in the mainstream media. It's hard to really know what's going on in Montgomery County, and we put out a lot of information. We email out a lot of stuff. We have a very active and informative website, but everybody doesn't know where it is. Everybody doesn't access it. And so we continue to make sure that we can get our information out deeper into the community. In Maryland, the counties and cities with the largest population of Black people all are below the state average of the population vaccinated, which is 11.6%. So all the ones with the greatest numbers of African Americans are failing to keep up with the rest of the state. It's too early to tell if it's an access issue solely or whether it's acceptance of the vaccine that is playing a role in these numbers. But whether it's one of these or both of these, and I suspect it's an aspect of both of these, the numbers we have right now aren't acceptable, and we're working to do a better job and make sure that more folks are getting vaccinated. We have vaccinated over 127,000, almost 128,000 people in the county. It's the most of any county in the state, and it's about 12% of our population. We've been getting shots into people's arms, while we're also focusing on our equity. Unfortunately, the county only controls about a third of the doses. We're getting about 15,000 doses a week. About 4,500 right now are coming to the county health clinic, and the rest go to hospitals and to pharmacies. We cannot control and have not been able to tell the other entities that we want you to want you to follow protocols that get at diversity and equity. For the doses that we give out, we are making sure that we draw on a diverse and equitable population. When we send out invitations for people to register, we're looking at zip codes, we're looking at concentrations of where COVID is in the community, and we're looking to make sure that we're inviting members of the entire Montgomery County community to get vaccinated, not simply first come, first serve. As I was saying before, you know, that if you're going to go by who has the best technology and those are going to be the winners in this race, that you're not going to get very diverse outcomes. And so we're proactively actually working to make sure we have a more diverse group of people coming in every week to get vaccinated. The Black population in Montgomery County makes up about 19% of the county's population. And right now we've been able to, of our total vaccines that we've given out, about 11% have gone to Black people. So we're below. We're about 2/3 where we should be, and that's our markers to try to raise that up. But we are getting closer to 19, and we're going to continue to do the work we need to get there. We have a significant amount of work to do, though, to ensure that the Black community as well as other communities get vaccinated. We are expanding our outreach efforts to reach more people, and tonight's forum is about raising awareness, answering questions, and addressing the concerns that people have about the vaccine itself and about access to it. The supply of vaccine is still very low. As I try to tell people, there are over 300,000 people in Montgomery County who are eligible to be vaccinated, and the county is getting a total of 15,000 vaccines a week. The scramble for appointments for those 15,000 vaccines has proven to be very frustrating for people. Up until this week, the county and other providers have not known from one week to the next how many doses we were going to have, which makes it impossible for us to schedule more than a week at a time. But now that we've been told that we should look to 4 weeks of 4,500 doses, we will be doing more scheduling farther out, so people don't just get frustrated because the week's schedule is exhausted. We want people to know that they can get a vaccine, and getting them scheduled is a crucial part of convincing people that they will get vaccinated. Yesterday, we launched the new vaccination center at the East County Rec Center, and the goal was to bring the shots to people, and they did a great job of bringing shots to the people. It was a very diverse group of people who were 75 and older, and we vaccinated 546 people there yesterday. We vaccinated one person who's kind of special to me. I've known him a long time, Harvey Ziegler. He was 100 years old, and he came out because he was committed to getting his first dose. And Harvey's lives in the Up County, but he came down to the East County to get his dose there. And it's always good to see Harvey, and I'm glad to have him get vaccinated. And hopefully he sets an example for other people in the community wondering whether it's safe to get vaccinated. He's an example of what I hope everyone will eventually do, and that is somebody who gets vaccinated. I understand the historical concerns people may have, and they're understandable. American history of racial injustice extends far into how Black Americans have accessed and experienced healthcare in this country. It's my hope that tonight's discussion will clear up some of the concerns people may have. We have experts here tonight that should be able to address your questions. And I want to thank you for joining us, and I look forward to the good conversation that's going to follow. Thank you.
Next, we'll hear from Councilmember Will Jawando.
Thank you, Tiffany, and thank you for all the work that you've been doing at a very difficult time. I appreciate being here with the county executive and with Dr. Kroll and my Dr. Verdun, who I saw, who's a friend and also an expert, and others. You know, this is, as county executive was mentioning, we are in difficult times, and we know that. We know we're here because COVID-19 is the latest manifestation of a systemic racism and inequity that's embedded in everything we do, in all of our systems. Health disparities up and down the line. You look at education, you look at transportation, you look certainly at our criminal justice system. Black residents fare worse. And that's because the systems were created with discrimination either explicitly or implicitly baked into the system. And so we're swimming uphill. And so we know that. And it's important to say that because any approach that we have to address it has to understand and start from that place. Last year, I introduced a resolution that the council adopted, declaring racism a public health crisis. We know that racism, not just the individual type, but the systemic and institutional type, leads to a whole range of poor outcomes for Black and Brown residents. I've said this before, I'll say it again. Unfortunately, we as Black people die in many ways due to this racism. COVID-19 is the latest manifestation and certainly a devastating one. But whether it's police violence, higher asthma rates, childbirth, maternal mortality, 3 times the rate of white women, go down the list. Who gets hit on our roadways by cars, trucks, and buses? Who lives in environmentally degraded communities where there's waste and lack of clean air and clean water? Those people are more often than not, unfortunately, still in society today, Black and Brown residents. So any opportunity we have to address these things, you can't do it in isolation. Certainly we need to have targeted strategies, which we're doing, to impact and to address the situation we're dealing with. But any long-term strategy, if we don't want the next COVID to come, we're gonna have to have a plan, which my resolution lays out along with our racial equity work, to address, that Tiffany's leading for the county, to address each of these areas. And that's, I just want to say that because we're going to be back here again for something else if we don't address these issues. Dr. Georges Benjamin, who heads the American Medical Association, lives in the county, who gave Mr. Ziegler the shot yesterday, said that we've lost life expectancy by 1 year for all Americans. For Black Americans, it's 3 years, which in terms of public health is an enormous amount of time. We already had lower life expectancy. If we make it to 75, which is higher than the average life expectancy for Black men in this country, that's who we're trying to vaccinate. And then you have the disparities. It was mentioned, I just want to put a bigger point on it. We represent a little more than 19% of the population, Black residents in the county. But the over 75 plus population, which is now being vaccinated, I think Dr. Kroll, correct me if I'm wrong, we're around 12% of that population, but only half of that percentage, 6 or so as of a week or two ago, maybe it's a little higher after our event yesterday, had been vaccinated. So you have a big gap even in that population. So we've got a lot of work to do. Hesitancy, we'll address those issues tonight. You'll hear from people much smarter than me in public health to tell you why this vaccine works and why I'm going to take it as soon as I'm eligible. But you'll also hear, and I'll reiterate what the county executive said, we are focusing on equity. We came to East County to 20904 where I live, and we're going to go other places because we know we need to bring shots to people where they are. If you're going to address these disparities, you're going to need to do that, boots on the ground, get in the communities, help people register, get them rides if they need it, and you're going to have to prioritize based on the impact. And that's what this is about. And tonight we want to answer questions. I already see some coming in the chat about how you can get pre-registered, how you can get your vaccination, what the health ramifications are. But we're going to work on all those things, and we're here to help. My office is here to help, and really appreciate everyone coming out tonight. Thank you very much.
Thank you, Councilmember Jawando. Councilmember Rice.
Well, thank you very much. And I'm not going to belabor the point because you've heard from both a county executive and one of my partners on the county council. Let me just address some of the other issues that relate to the conversation around reluctance of testing and some of the numbers that folks are seeing when it comes to percentages. And it's interesting. I want to tie in something that Councilmember Jawando said that I think we all need to consider as a part of these numbers and the data that we're seeing. While yes, we do see that a large percentage of the above 75 cohort that have been vaccinated here in the county are white, that also speaks to the morbidity factor and how many people aren't living past 75. That's a part of this number as well that we also need to consider and understand. And it's unfortunate. It really is a part of what Councilmember Jawando was talking about when we declared racism a public health emergency here in this county. It is one that affects when it comes to the disparities. As you look at the Tuskegee study, there are people still in Tuskegee today who are insisting that they are not taking the vaccination because they remember the Tuskegee study and what happened. That generation is still alive and still remembers the tragic incidents of what happened about those communities that were lied to and used as an experiment. And so folks are still concerned about those kinds of things all throughout our communities, especially in our communities of color. And so we've got to address all of these issues, but I think that first and foremost in front of us right now is the fact that we don't have enough vaccines to put in the arms of people. And you heard our county executive talk about the challenges that he faces and how he's trying to do more to get more vaccines. And we appreciate that. The reality is that from our perspective, it's a state and federal issue to where we have not seen those vaccinations flow to the county. And if we are to have control over what is happening and how we are to dictate how the vaccine is rolled out, we must remain in control of these vaccinations. When you send them to CVS, when you send them to Walgreens, when you send them to Walmart, when you send them to Safeway, when you send them to Giant, all of those places are not adhering to the same standards that we are. They're in different categories. You have 20-somethings and 30-somethings that are getting the vaccination in front of elderly people who are people of color, who are higher predisposed to have a negative reaction when it comes to being infected with COVID. It is shameful. It is shameful, and we need to be calling out anyone who allows for this to continue to happen. And so we have got to hold our leaders at the state and federal level accountable if we continue to see this process move forward. Keep in mind, at these mass vaccination sites, right, we still have folks who are getting the vaccine who aren't even on the list. Ask if they actually get and check to see what their ID is in terms of how old they are. Ask if they are getting questions about who they work for and verifying that they're indeed an essential employee or a nurse or a teacher. And then you'll understand why the disparities continue to exist and why people are still distrustful of the system. If the system allows for people to jump the queue, if the system allows for those who are oftentimes disconnected and marginalized to continue to suffer in the shadows, while those who are privileged and have connections continue to be vaccinated, then of course we will have people who distrust the system. And so we've got to do a better job. Tonight is one of those steps. By us having this conversation and making sure that our community knows all the ways in which it can continue to access the system. And we need to continue to promote our county system, led by Dr. Kroll and Dr. Gales, who are doing tremendous work in really focusing on our communities of color, our communities of greatest need. And I want to close by thanking them for their great work. Because if it were not for them, people like my mother, people like my father, who have multiple pre-existing conditions, who are all over age 75, would have not been able to get the shot if it were not for the policy set up. There needs to be more. We need to continue to make sure that we're making the strides necessary in working with our Department of Health and Human Services to ensure that we can continue to get these doses in the arms of those who are most vulnerable and those who need it most. So thank you very much, guys. I look forward to the conversation.
Thank you to all three of our elected officials, and I want to acknowledge Councilmember Gabe Albornoz, who's also here, and acknowledge that Council President Tom Hooker has a representative who is also available for questions. Next up, it is my pleasure to introduce our panelists who've helped us both medically and administratively navigate the COVID-19 virus, and they will do brief presentations. Our first panelist will be Dr. Nicole Verdun. Dr. Verdun is the director of the Office of Blood Research and Review at the Food and Drug Administration. And Dr. Raymond Crowell is our director of our Office of Health and Human Services. And of course, Dr. Travis Gales, who is our Director of Health and Chief of Public Health Services here in Montgomery County. First up, Dr. Nicole Verdun will give us a presentation. Thank you.
Thank you for the welcome. Just slides, please. Next slide, please. So I wanted to just start with discussing COVID-19 and African Americans. So according to the CDC, African Americans are 3 times more likely to be hospitalized with COVID and 2 times more likely to have death related to COVID. Next. So African Americans are disproportionately affected by COVID-19, and vaccines are a way to close these existing gaps. By getting a COVID-19 vaccine, you are protecting yourself, your children, parents, grandparents, and other loved ones. The COVID-19 vaccine development process is moving faster than normal because the medical and scientific community have made it their highest priority, not because any steps have been skipped. So phases that are normally done one after another in vaccine development have been completed in parallel. So for example, ramping up manufacturing capacity while a clinical trial is underway. Normally, you would wait for a clinical trial to complete prior to ramping up manufacturing capacity, but these things were done in parallel because we are in the middle of a pandemic. And only safe and effective COVID-19 vaccines that have been rigorously tested on tens of thousands of volunteers are approved. So messenger RNA vaccines, they don't incorporate into the DNA or cause the disease. They actually provide a blueprint for our cells on how to make a harmless piece of something called the spike protein, which is found on the surface of the virus that causes COVID-19. This triggers your body to develop antibodies to protect you if you are exposed in the future. The body then breaks this down and gets rid of the messenger RNAs soon after using the instructions. So it's not something that remains in your body at all. Next. So there were 2 vaccine trials that I would like to go through the demographics. We currently have 2 emergency use authorized vaccines, Pfizer vaccine and the Moderna vaccine. The Pfizer vaccine enrolled 43,551 participants, and the Moderna vaccine enrolled 30,418 participants. There were about 21,000 in the vaccine group in the Pfizer trial and 21,000 that received a placebo vaccine. And you see comparable numbers for the Moderna vaccine. Of the participants in these trials, almost about 10% of those were Black or African American. About 20% to 26% were Hispanic or Latino, and about 21 to 25% were ages 65 or older. So both trials combined had about 3,600 African Americans that were in the vaccine arms and a comparable number that were in the placebo arm. Next. How did these trials measure effectiveness? So they randomized participants to receive either 2 doses of the vaccine or 2 doses of a placebo. And they measured the ability of the vaccine to prevent clinical COVID-19 occurring 14 days after the 2nd dose of the vaccine. So you actually had to have symptoms and not just a positive test for this to be deemed an event. And I want to stop right here for a quick second. The reason why these trials were able to get done in such a fast fashion was not that anything was skipped, but when you have an endpoint, which is something like developing clinical COVID-19 in the middle of a pandemic, you just measure the number of people that got clinical COVID or that didn't get clinical COVID. And it's very easy to get to that endpoint when you're in the middle of a pandemic where people are actually getting infected. And so it wasn't rushed. It was just that they got to a primary endpoint, or the ability to see the difference between the vaccine arm and the placebo arm quite rapidly, unfortunately, because we had a lot of COVID at the time that these trials were being done. Next. So the vaccine efficacy in the phase 3 trials after 2 doses, in summary, both the Pfizer and the Moderna vaccine had about a 94 to 95% efficacy overall, which is outstanding for a vaccine. And it also, of note, prevented severe COVID-19 as well. Next. In terms of the vaccine safety in these phase 3 trials, the most common reactions in both vaccines were injection site pain, fatigue, some headache, muscle pain, chills, joint pain, and fever. And that tended to happen more after the 2nd injection than the 1st. Of note, these vaccines should not be administered to individuals with a known history of a severe allergic reaction to any component of the vaccine. Next. So pediatric trials are ongoing. The messenger RNA vaccine trials in pediatric participants are enrolling children that are ages 12 and older, and they are expected to complete enrollment by April or May. There are future trials that are planned in younger pediatric age groups, ages 5 and older. Next. We also had a vaccine and related biological products advisory committee meeting, which is a public meeting that goes over the data that has been submitted for each of these vaccines. Our next one is February 26, 2021. And at that meeting, we will be discussing the Janssen Biotech COVID-19 vaccine. This is a non-replicating viral vector vaccine, so it's different than the messenger RNA vaccines that have been approved. And they have submitted an application for approval for adults 18 years and older, and that is currently under review at the agency. Next. So in summary, the currently authorized vaccines for COVID-19 are both safe and effective. And the vaccines are an important weapon in the fight against COVID-19 for everyone, especially African Americans. Thank you.
Thank you, Dr. Verdun. Up next, we have a presentation from Dr. Crowell.
Good evening, everyone. I'm going to share my screen here and do this PowerPoint for you all and walk you through some things that are going on in Montgomery County. And hopefully you can see this as we go through. So I'll need somebody just to give me a fact check. Can you see that now? Is that, you seeing this first slide up?
Yes.
Great, thank you. So I want to start here. And if this stops changing, let me know. I'll have to make some adjustments. But this is to our point, the point that was made earlier. This is Mr. Ziegler, who is our centenarian, who got his vaccination yesterday afternoon, and Dr. Georges Benjamin, who's the Chief Executive Officer of the American Public Health Association and a Montgomery County resident. He's my current hero of the day, because this is an older Black man who has said to us, I'm getting vaccinated. I know the importance of this, and it is something that I'm hoping that people will see and watch and take note of as we go forward, that this man understands what we're trying to do here. The other thing I wanted to share with you all is just to one of the council members made a point earlier about the percentage of the population that we represent at 75 plus. And you can see, as you look at our overall numbers, we're at 19% of the population, but as you get older, those numbers start to dwindle dramatically. And that is a story about health disparities and poor health outcomes and a legacy of discrimination and lack of access that we need to make it our business individually and as a society and as a county to change that narrative around COVID and this virus. And the only way we do that is by getting those doses to people who have been underserved and who don't have access to them, and getting those people to take those vaccinations. So those are the two things that we've got to do: get the doses and get people willing and engaged in taking the vaccine. So I want to talk a little bit about what we're seeing in terms of timelines for COVID, and then talk a little bit about an equity framework and how we're doing in terms of vaccination in the county. This is going to take a few minutes, so bear with me. I'll try to be as quick as I can to get through this. But this is our lifetime of the pandemic from start to finish in terms of the number of cases per 100,000 residents. And we thought we were over this back when we started turning down back in May, and at the end of May and June. We thought we were thinking the coast is clear and we're ready to get over this and get on with our lives. Unfortunately, that turned out not to be true. As we moved into the fall and winter, we saw a second, even worse spike with more death and more cases, and we're coming down out of that now, and we're coming down fast, getting back down to where we were back in May and June and July. But I don't think we need to be deceived that we are out of the woods yet, and we won't be until we get ourselves vaccinated in sufficient numbers. We track a lot of different things, and I'm not going to go too much into this, but we track a lot of things, including new cases per 100,000, the positivity rates, which are down right now, going in the right direction, and things like hospital bed usage and percentage of cases and changes in percentage of cases. Many of those are going in the right direction right now. We need to keep them going in that direction. When we talk about an equity lens, we've started by looking at what's happening with cases and where we're seeing cases around the county. So testing is our tool for that. We use testing as radar to tell us where we're seeing cases, and we have been, and in what communities we're seeing cases and how many. If we don't test, then we don't know where the disease is. If we can't find the disease, then we can't fight it directly and head on. So we've been at 40 to 50,000, 60,000 tests since late November, and we need to stay there. People are now so focused on vaccines, they're thinking testing don't matter. It is very important that we continue to get tested as we go forward. Where am I? Oh, did I lose it? Here we go. Oops, missed one. Okay, so what we're seeing over time when we look at race and ethnicity in these cases, when we track this information by race, we are saying, sorry, I'm bouncing around a little bit. What we're seeing is that the positivity, the number of cases that we see are high in the Latino community and high in both white and Black communities. This is our spread of cases around the county, and this is also a function of who gets tested and who doesn't get tested. So we have put on some efforts to try to make sure that people in the community have access to getting tested and can continue to get tested over time. But this is where we begin to track some of the disparities and some of the outcomes by race and ethnicity in the county. We looked at this vaccination. This is the other thing that we see. And one of the reasons that we're looking at when you ask why are we vaccinating 75 plus and why are we focused on 75 plus, it is because of the majority of the deaths in Montgomery County have been in that 80 plus age range. And there's another way of looking at it that I wanted to share with you about why we're looking at this 75. Age is also an equity factor for us. You're four times, people who are 80 and over are 4 times more likely to have died of COVID in the county than residents who are 70 to 79, and so on down the line. So it is important for us to stay on top of this in terms of age and to make sure that we are vaccinating folks who are some of our oldest and most vulnerable members of this community as part of this process. So we identified, as we looked at where the cases were, we identified zip codes that had the highest numbers of cases. And don't be deceived by this. When you look at this map, it looks like, well, hell, that's half the county. It really isn't half the county when we start looking at it. But these red spots are places where, when we looked at this, the case rates were highest in the county, and the death rates were highest in the county. And we looked at that by zip code. We also looked at it by race and ethnicity within zip codes. And then we took a deeper look, and we began to look at it down to census tract level. And so what you see when you look at this is on the left side, you see the cases where COVID has been most intense throughout the life of the pandemic in terms of numbers of cases. And on the right side, we know that COVID changes over time. It moves around over time. So what we see on this side is where COVID has been in the last 3 months. And it's those last 3 months that we're using as our primary guide around this. So we're looking at where is COVID most active, where is it attacking the county now, and down to catchment areas. So we're not just looking at zip codes. Within those zip codes that I showed you a moment ago, there are target areas, there are communities that are hotspots for COVID. And that's where we're trying to attack the COVID, trying to attack this virus is in those hotspots. So let's look at those hotspots in relationship to sort of traditional kinds of things that we look at in the county. And you'll see this hotspot divides along the 270 corridor. So I'll go back a second and bounce forward. It also aligns with poverty. It also aligns with communities of color, Black and African American communities, with folks who are low rental unit cost rental units where housing may be crowded or overcrowding and or indicators of poverty for some communities. And it also aligns with where our Hispanic community and Latino community lives in the county. So COVID is attacking in Black and brown communities within our zip codes. And that is one of the reasons, as we track this with an equity framework, it leads us to think about how do we vaccinate with that same equity framework in mind. So we have, when we've looked at vaccines across the county, the CE noted that there are 120,000, 127,000 people who've been vaccinated, who've received their first shots. And I think these numbers are a little low right now. I think it's actually increased as of today. And another 50,000 who have been completely vaccinated in the county. We are vaccinating in priority area 1A and 1B right now. 1A was the priority area that we started with first. And those are the folks who are administering the vaccines and taking care of us in the hospitals and doing our testing for us. We needed them to stay safe and to be well, and not be at risk of transmitting the virus or catching the virus, so they could continue to help keep us safe. We looked at our urgent care workers and our public safety officers who are out on the streets responding to fire and keeping us safe. And we looked at our shelter staff. We vaccinated our shelter staff. We're now in 1B and vaccinating 75-year-olds and up. And we are using the Moderna virus for most of our vaccinations in public health in the county-run vaccination sites. Our next tier down, as we get through this 75 and older group, of which there are several, when you add these first two tiers together, there are several 100,000 people that we're looking at in trying to get through vaccination. We are at about 50+% across the entire county in vaccinating 75 and older group. And we've hit some, we're continuing. We estimate there'll be a few more weeks before we're through that group, but we're having discussions about when and how we open up to the next tier to adults 65 and older and the essential frontline workers as well. Actually, we're at 57.3%, sorry, it was updated. 57% of the population is back of the 75 of the 75 and older population has now been vaccinated, I think. So there's been a lot of conversation about how are the vaccines rolling out and how are we doing in the county and how do we compare to other jurisdictions. Montgomery County, and I'm talking now about our overall doses first and second, and the county, Montgomery County as a health department has been leading the way in getting doses out. We've vaccinated all over the county more people than anyone else, any other jurisdiction in the state. So we should be, I mean, the group needs to be proud, both the public health system and the rest of the folks who are providing vaccines to our folks need to be pleased. And we just want to acknowledge that the work that Dr. Gales and his team has done. We have vaccinated about 4.8% of our population has received their second doses. I think 12% has received their first doses, and we are ahead of the county, the state average in terms of first doses being administered at this point. When we look at the vaccines that have been delivered by Montgomery County, our public health officers, Dr. Gales and his staff and Fire and Rescue, we routinely have demonstrated, we have consistently delivered 90 plus, 95, 97% of our doses. We get doses in and we turn them around very quickly in our system. So we are, again, leading the state in terms of the numbers of doses. It's not a race against the other counties. Please know that it is a race against this disease and I'm proud to say that this county is doing a really good job in doing that. When we start looking at vaccines administered by race and ethnicity to this point, this is what we see in terms of, and this is one of the places where disparity starts to show up in the press, in the system and in the process. We see that white residents of the county account for 43% of the population overall, but 54% of the vaccines administered to this point. And to focus more specifically on Black community, 19% of the population, but only 11% of the doses that have been received across any of the full range of places where we're distributing doses, where doses are being handed out and given out. Doses are being given out. The county is doing dosing. The hospitals are providing vaccine. Pharmacies are providing vaccine, and the state is standing up mass vaccination sites in a number of regions around the state where they're providing vaccine as well. We do not have a mass vaccination site in Montgomery County at this point. When we look at what we're doing, we decided when we saw this information, the state system is first come, first serve, and if people have tried to register for a vaccine in the state system, you know that you could see 400 vaccines pop up and a half an hour later they could be gone. So if you're not watching constantly and continuing to refresh, you end up with a system where you're chasing vaccine. We decided, and because it is first come, first serve, it is biased to folks who have digital access to computers or who have family members who can sit and watch the computer and register them. We stood up a pre-registration process in the county so that we could help stop that chase, so that people would know that they could sign up, and once they had signed up with us, there was a vaccine being reserved for them at some point. We receive, the CE noted, about 4,500 vaccines a week right now. That's not a lot, and it takes a long time to get people dosed with that number of vaccine, but we are pre-registering people and asking them to go on our website and pre-register and be ready when we call you to say, look, it's time for you to get a dose. One of the challenges that we're seeing, we've registered 300,000+ people, almost 350,000 people since we started this process back in early January. And you note on the right side that 66% of those folks who have pre-registered are white, 15% are Asian, 9% are Black, Hispanic and Latinx, 8% are Black or African American. And there's a small group that didn't report their percentages, but you see these numbers. And this is one of our challenges in the county, is that we need to get people to register. When you look at where people are getting their doses from, Montgomery County Public Health accounts for most of the greatest percentage of doses for Latino community, for the Asian Pacific Islander community, and for the Black community. Other locales account for the balance of that, but we're the single biggest provider. We account for 56% of the doses administered to folks who are 75 and over. To make matters worse, I showed you that our registration is not quite an equitable pre-registration, but I want to show you what that means for us in terms of doses administered. We are making sure that we distribute doses in an equitable fashion. So one of the things that we do in this process is that we've identified where the cases are highest, where the highest numbers of cases are in a zip code. When we target areas for vaccination, we distribute those doses and invite people to come and be vaccinated in relationship to how intense the virus is attacking that community. So if you're a member of the Black community and you're 90206, and in 90206, we see that there's twice the rate of infection in Black community than there is in that whole zip code as a whole, then twice the number of doses we try to identify and invite people to come and get vaccinated, and twice the number, so that we create that equitable arrangement. When you look at the outcomes of this is where Montgomery County is at the top. 62% of the folks who've been vaccinated who are over 75 are, I lost the page, are white, 16% Asian Pacific Islander, 9% Black, and 9% Latinx. But when you look at it in comparison to other groups, what you see is those numbers start to shift around a lot. The pharmacies have 27%. We don't know who they are because they don't identify or don't collect or don't report that information. But you see the numbers for our Black and Brown and Asian communities. When you look at it overall, what you see is that Montgomery County has a, let me try to move this around a little bit, accounts for, I'm sorry, I keep bouncing this around a little bit, accounts for 64% of our vaccines have gone to white residents, 17% going to Asian, 9% to Black community, and 10% compared to the overall provision of vaccines by other providers across the state. And so you see the disparity. We are working to try to address the disparity, but our equity framework is what gets us to where we are now. When we look at pre-registration, yes.
I'm just going to ask you to wrap up really quickly, just so we want to get Dr. Gales's comments as well as comments from our question and answer. I'm sorry.
Okay, with a lot of questions. I know this was a little longer than I intended it to be, so I'm going to wrap up this way. When we look at pre-registration in our system, what we see on the green half of this is where people are registering and really well and doing a great job, and on the other side, the red sides are where we're not vaccinating at a level that we need to vaccinate at. I'm going to try to shrink this down a little bit if I can. This is what I want to leave you with. If we are not vaccinating, we are at greater risk, and we encounter COVID, we are at greater risk of severe disease and or death. If we are vaccinating and we have some immunity, we will suffer less death and less severe illness in this process. So we need to figure out how are we going to get ourselves exposed and infected and get some immunity? Or are we going to try a combination of, we know we've been exposed, can we get vaccinated now and begin to get ourselves taken care of? So I will stop the share there, and I will end with where I started on this, and that is that what I've said to people is this, and on a personal note, I want to be in a room with my aunt later this year, drawing a breath of fresh air without worrying about what's passing between us other than love. So, and I want that for everybody that is in this community. So we only get there if we do this together. Thank you.
Thank you. I want to remind our audience to please send your questions to our question and answer box. Here, shortly, we will start our question and answer session of the program. Right now, we will have comments by Dr. Travis Gales.
Good evening, everyone. Can you hear me okay?
Yep, we can.
Yes. Okay, perfect. Forgive me, I'm having some technical difficulties and my camera's not working, but I think you know what I look like, so take your best image and use that as your imagination tonight. Thank you all for the opportunity to be here with you. Dr. Verdun and Dr. Kral's presentations laid out a lot of information. I won't add anything to that, what's already been said so far, and leave time for questions. But thank you for the opportunity to be here with you.
Thank you, Dr. Gales. I also want to acknowledge that Councilmember Nancy Navarro also has representatives here who are will take questions in the question and answer session as well. Let's start our question and answer section. There are lots of good ones and lots of comments too. I think the first one I will address to Dr. Gales. There's lots of conversation in our in that chat about the process of registering to vaccination. Would you please run down the process of registering for vaccination to actually receiving a vaccination for our listeners, just so they are clear about how that goes and where, how this whole process is taking place, both for folks who are calling the line that we have set up, as well as those who are using the online portal that we have.
Sure. Well, I think the first thing to emphasize is that the registration portals and platforms that we're using, at least for the county vaccination process, have been required by the state. So the PrepMod registration system that you've heard us talk a lot about in the media, we're required as the health department to use that platform the State Department of Health. Now, there have been lots of different issues with that we've communicated to the state, and they are working to fix that and address those issues. But the way the system works is this. So we've created a pre-registration platform in the county that allows individuals to go online to the county site, enter their information, as well as delineate any type of, criteria where they may meet one of the prioritization groups, whether it's the type of work you do, a type of medical condition, any of those types of things, to give us a sense of where you fit within the priority group, so that when it is that group's time, we're able to then send you a registration link to the PrepMod system so that you can go online and schedule your appointment. Now, one of the challenges with that system is that, and this is one of the things they're working on now, is there have not been a lot of security parameters around it, which have made it easier for individuals to send a link to listservs and post on social media. So individuals who don't meet the criteria are able to register in the system. One of the other challenges and difficulties with the system is that it doesn't allow you to put in screening information to prevent individuals from registering. So individuals who have not met the age criteria, if you will, have been able to register in the system. And we've had to turn folks away from the vaccine sites because that's a challenge, as it creates holes. It takes up appointments for individuals who are. So once we do reach your prioritization group, if you've pre-registered, you're then, based upon all of the criteria that Dr. Kroll presented in his remarks, we use those factors to determine how the doses are allotted and allocated. In a perfect system, we would have ample vaccine that would cover everybody who's eligible. Unfortunately, we're in a system that we have significantly lower capacity to provide vaccines than those who are eligible. For example, when we think of our individuals in the county who are over the age of 75, we have somewhere between 72 to 74,000 individuals who fit that criteria. As has been pointed out, we've been receiving 4,500 doses a week as the health department. So based upon those numbers, we've created the prioritization metrics, and we have an equity framework that Dr. Kroll has mentioned that we're using to make those allocations. Now, any of the other sites throughout the county that are not health department run are open to individuals in the 1A, 1B, and 1C categories. Some of those systems use the PrepMod system that the state has. Others have their own registration system. So it's dependent upon that particular institution or venue and determine how you go through the registration process at their facility.
Thank you. This next question is for Dr. Kroll. There are lots of questions here in the chat about access. There's one in particular that I think cuts right to it. What is the county doing now to ensure more access for Black, Indigenous, people of color, particularly elders, to the vaccine?
It's a good question. I think, one of the things that we have been doing is things like taking vaccine, our effort yesterday to take doses to East County to try to make it available and bring it closer to Black communities and call awareness to the fact that we need those communities and those members in those communities that are hardest hit to be aware of the need and availability of the vaccine. We have been we are reaching out with in partnership with the CCC, what was the census team that helped to make sure that everybody in our community was counted for the census, has reached out, has been reactivated so that they can reestablish those networks in those communities, those networks in those communities that are affected by COVID, so that we can get folks registered and vaccinated. Our effort now is to really try to get more folks pre-registered so they're in our system, so that we can make sure that when we get doses, we can send those doses back out to those communities. If we don't get them pre-registered, then we can't do that. So we're working with the churches and working with our provider groups that have been doing vaccination or testing around the county, so that we can make sure that as they get tested, they have an opportunity to pre-register, and as they as their name comes up, we can call them down to get vaccination. The other thing I think is that we're trying to do things like this to make people aware of the issues, to address the issues. There are plenty of folks who are ready to take the vaccine. We know long-term we've got to deal with issues of hesitancy and concerns and fear. We're working with the churches and reaching out to the community, to our churches, to get our trusted messengers, the folks who are in the pulpit on Sunday morning and talking to their elders and talking to their members, so that they can in turn get folks signed up and ready to take the vaccine.
Thank you. This next question is for Dr. Verdun. Dr. Verdun, will you speak to how the forthcoming vaccine that you spoke about earlier in your presentation is different from the Pfizer and the Moderna vaccine that is currently on the market and being administered?
So they're packaged differently, and they deliver the vaccine differently. So the vaccine that is currently under review is a non-replicating, what we call viral vector. What that means is that it's packaged inside of a vector is the package. It's packaged inside of a virus that doesn't replicate or produce. And then that triggers your body to develop antibodies. It's just a different way to package a vaccine, and it's a different manufacturing process. And there'll be differences that will be discussed at the advisory committee meeting. It's currently under review now. So there's a limit to some of the things that I can say about it, but there are differences, and it's important to look at the data.
Thank you. And this next question is really a toss-up between Dr. Gales and Dr. Crowell, so I'll make you guys kind of tussle over this one. Can or will the county use mobile med to register and to vaccinate residents?
Well, I can take a stab at it, Dr.
I'm
Crowell.
sorry, Dr. Gales, we can't really hear you.
Can you hear me now?
You need to be a little louder.
Okay, can you hear me now?
That's
Is that
perfect.
better?
Yes.
Okay, sorry about that.
That's all right.
So again, it's not my night for technical issues. But so we have actually been looking at a host of strategies to utilize mobile platforms. We know that Mobile Med was one of the first FQHCs in Maryland to receive a small amount of doses. And so we have been looking at them as well as a couple of other vendors, as Dr. Crowell pointed out, in an attempt to bring doses of the vaccine more directly and closer to the community. I know that one of those vendors we met with last week and are finalizing how we can pilot that program, hopefully by the end of the week, at least providing doses to a significant number of homebound seniors that are known within that particular clinic.
All right. This next one is for you, Dr. Crowell. Can we combine testing and vaccination sites to ramp up and emphasize that both are free and do not require insurance and will not create immigration or immigration-related risks for residents?
So the first thing is that there is no risk for immigration issues for residents, and we'll be very clear about that. We do not ask about your immigration status at all in this process. At no point do we ask that question for people, The second one is that to the person who raised the question, is that the vaccine is free, and it is free to all folks who present themselves looking for the vaccine, especially through county and state distribution sites. And the third one is, can we combine testing and vaccination sites? We are certainly looking at combining testing and pre-registration. It's a different set of requirements, but I would not rule that out as something that we can do at some point. As we go forward and have more doses and more opportunities for distribution, I would say that's likely, but I would also say that we are also talking with folks who are doing testing right now about the possibility of shifting over and doing some vaccines. So we've got providers who might be able to do both and maybe do it on different days in the same communities. Since we have folks who are doing testing in the community and they are trusted and in the community. We want to keep them there and doing that. If it makes sense to shift over and do some vaccination with those same providers, and I think yes, we would.
Okay, thank you. It's also a question that's been asked a number of times in the Q&A section, and that is, when will the county, or how will the county make the decision to go to Group 1C in their vaccination protocol? And I will leave that for either you or Dr. Gales. You being Dr. Crowell, I apologize.
Go ahead,
I think the decision will be is we want to make sure that everyone within that respective group has an opportunity to get a vaccine link to schedule an appointment. We are not going to wait for us to achieve 100% vaccine uptake in each of the categories before we move forward. We anticipate that based upon where we stand right now, we are closer to being able to move to the next group than we were before, than we were at the start, as oxymoronic as that sounds. But we've made good progress, and we're finding that we are a good amount of seniors are picking up vaccines in other places. So our hope is that within potentially the next week to 2 weeks, that we will be able to move to the next group in terms of what the county is prioritizing. But let me reiterate again, is that individuals at those non-county sites, individuals in the 1A, 1B, and 1C categories are eligible to get vaccines in those places.
I would add that we're at 57% of seniors 75 and older, and that's from the end of December through now. So in Christmas week until now. So we are a lot closer than we were a month ago, and we are continuing to pick up the pace on it, I think. So it won't be very much longer.
Okay. This next question is for Dr. Verdun. How can you get your kids involved in the pediatric trial if you are interested?
Yeah, great question. So there is a website, or an email actually, clinicaltrials@modernatx.com, which I can put into the chat if that's helpful. And there is also a phone number which will give more information about sites. And there's also something called clinicaltrials.gov, which is run by NIH, where they tend to have a lot of information about particular sites for trials. But I will try and put that in the chat if that is accessible to everyone.
That'd be great. Yeah, if you could leave that for us, then we will also pass that on after the session is over. All right, there are a few others. So I guess will Dr. Gales or Dr. Krause speak to the importance of pre-registering for the vaccine?
So pre-registration does two things. If you think about how the state system runs right now, it is first come, first serve, which means the first person in gets the vaccine, and you kind of have to watch that system and stay on top of it. The other thing about the state system is that right now it does not do anything in terms of an equity framework because it's first come, first serve. It does so without regard to how severely the community has been impacted. With pre-registration, when we ask people to pre-register in the county, they don't have to go back and look. They're in the system, and they know they're in the system, and they're not chasing it. When the dose becomes available, we will reach out to them and let them know that dose is available for them, and they can schedule an appointment, and they will be there. They don't have to rush to schedule an appointment. So it gives them a little bit of security. So it may be a while before you get there, but you know that your name is in that system, and that when it comes, we will be calling you to get a dose. It also gives us a chance to make sure that there's an equitable opportunity for that dose as well. So we're trying to address the disparities in access by the pre-registration system as well.
Okay. I have another really good one. I think this is important for folks to understand how much of the vaccine is actually controlled by the county, and that is, what phase is the county in administering vaccines, and why are they finding people younger than them or their parent who have already been vaccinated? So I'll leave that one for Dr. Gales.
So the county vaccination clinics are prioritizing individuals who are 75 and up. We've also provided vaccines to many individuals who are in the 1A category, who met the criteria for healthcare workers or other categories that were covered within that, and they may or may not be above or below the age of 75. Now, we have made our best effort at the county sites, again, due to that prioritization, to if individuals who don't fit those criteria for 1A designation or over the age of 75, we have turned them away and canceled those appointments. Now, again, at any of the other sites that are non-health department related, individuals in the categories 1A, 1B, and 1C have been able to take advantage of those opportunities for vaccines.
Okay, got you.
Yeah, if Tiffany, could I chime in on that?
Sure, please.
So it's important. One of the reasons we've been pushing the governor and the state health department to have an equity framework, number one, is that there are so many places you go and you raise people's expectations. I'm reading through the questions. If you say, hey, there's going to be a giant, but they only have 100 doses, and then you say there's mass vaccination sites, and you send a text message out to the whole state, and people are driving from all over the place, it creates unreasonable expectations, especially when you don't have a equity framework like we are doing here in the county. It makes it very difficult, particularly for the Black community in underserved communities. And so a couple of things we've been pushing for. One, we're the largest jurisdiction. I saw this question as well. We should have a mass vaccination site. We've offered, I know Dr. Gales and others, we've said the fairgrounds, the county fairgrounds, other places, we should have that. Two, give us more doses, and we will continue to get them out. As you saw from the great charts from Dr. Kroll and their team at Public Health with Dr. Gales, we get shots in arms quickly, and we're trying to get them to the right people in the order of this prioritization. So get us more shots. We've asked for 15,000. We're getting 4,500 for the next 4 weeks. That's a federal issue and a state issue, but give us more. And then when you give them to the private sector, to the hospitals and the pharmacies and others, require them to have an equity framework, to track who they're giving it to do it in order. And that's going to help, with this, everyone's frustration going around not knowing how to get it. And so we continue to push for that. So if you're looking for advocacy points, those are some points that are out of the county's control right now, but that we are continue to try to implore the governor and the State Department of Health to do, so that we can get more shots to people, particularly to the Black community. So I just wanted to add that. Pre-register, but understand it's this larger context.
Actually great context, and thank you for that, Councilmember Jawando. Our next question, will there be more weekend and pop-up vaccination sites in the county? For Dr. Gale or Dr. Crowell?
Sure, we're working on that right now. We're also working to try to increase opportunities where we can support our community partners to be able to stand up alternative sites, not only on the weekends, but potentially looking at how we could have evening hours as well to make the vaccine opportunities more accessible.
Thank you. And a few more. What percentage of Black residents over 75 have registered with the county to receive vaccinations? Do we know that? And if not, can we get that information?
I don't know that we know that. I can probably tell you what percentage of the people who pre-registered are Black
Okay.
and over 75, but I don't have that in front of me right now. We can get that to you and put it in the chat, or I can send it to you a little later, Tiffany.
I know a couple weeks ago, or maybe last week, Dr. Kroll, you showed the slide earlier that 12% of 75 population is Black in the county, right? That number. And then I guess the other number, you had said 6%, maybe it was a week or so ago, had been the registrations, but I don't know if that's changed.
Right. It's not exactly, yeah, that's right. It's 12% of the population. I think it's changed it's more than 6% of the pre-registration. So we have to do some math to work into what that means in terms of the numbers of Black residents.
But not enough.
Not enough. Bottom line, it is not enough. Thank you.
This is a great place to let folks know that if your question is not answered here in the live session, that we will take these questions back and answer them and get those answers back to you. You will also be able to get a copy of both Dr. Verdun's PowerPoint presentation as well as Dr. Crowell's PowerPoint presentation. I know several folks have already asked about that. And now I want to go to our elected officials for some closing remarks for tonight.
Am I allowed to answer one more question that I think is important that I saw? Sorry. So there's a question about pregnant women and vaccination. And I think it's an important one. So there is a trial that will be starting in pregnant women, a formal trial, but there have been over 1,000 pregnant women that have received the vaccination, either in the setting of the clinical trial or subsequent to that clinical trial, and that we have not seen any adverse outcomes. So right now it's a decision that is made with that woman and her healthcare provider.
Interesting. Thank you for that. I just did not see the question. We have 99 plus questions in here, and I am doing my best. So thank you for picking that one up, Dr. Verdun. All right, now I'm gonna ask our elected officials for some closing remarks. We're gonna start with Council Member Craig Rice. If he would close us out or give us some closing remarks before we wrap up tonight.
Sure. Well, first, I would just want to thank the panelists for all of their great information that I hope that many of you in the community found helpful. We get these updates every week, multiple times throughout the week. In fact, we'll be talking with our health partners tomorrow morning. And so we get an opportunity to hear each and every day about what's going on with vaccinations, what's going on still with testing. I would just want to say one thing that we haven't touched on, and that's to encourage folks to continue to get tested, to give us a better understanding of what's going on in the community. I fear that because we've kind of migrated towards vaccination, that unfortunately what I'm seeing is that folks are not getting tested any longer, which is not giving us a true snapshot of what continues to happen in our communities. And so I would encourage folks to please continue to get tested, not just for the sake of getting tested, but if you are exposed to someone who may have contracted COVID or may be exhibiting symptoms, to still go and do that. But in addition, one of the things that you've heard both Councilmember Jawando and I talk about is about being passionate about making sure that we have our voices heard about why we need more vaccinations. And we as your elected officials can certainly continue to push that with our governor, but our governor answers to everyone, not just to elected officials. They need to hear from us that we are not okay with the fact that we have not been given the vaccinations that are necessary. So I want you to make sure that you reach out and send an email, send a text, call the governor's office and say, I'm in this community and understand that we are not getting the vaccines that we should and we want more. Because to stand up those pop-up sites, to stand up those weekend sites, for us to do more in the community means that we've got to get more vaccine. The reality is that every time a mass vaccination site opens up that's outside of Montgomery County means that either Montgomery County gets less vaccine or isn't getting more. Either one of those is a bad thing for us. And keep in mind, we were getting more than 4,500 doses. We got reduced. Let me say again, we got reduced to 4,500 doses. So again, we can do more. You've heard the health department say we can do 15,000 doses. I think we can actually do even more than that with some additional resources that the county council and I know the county executive stand ready to provide to our Health and Human Services Department should we get it. But we're not even anywhere close. We're less than 1/3 from our maximum capacity. That's crazy, and it's shameful. It is because we still have folks who are pre-registered who do want the vaccine. And then we've got to do a good job about making sure that we're talking to our community members who are a little bit skittish about getting the vaccination as well. And while we understand, and I don't want to try and shame anybody for being fearful, because I understand what our history represents, but at the same time, we also have to make sure that we're providing those opportunities for folks to keep themselves and their families and their friends safe. And that's what this vaccine represents. I'll just close by saying this. I look forward to taking the vaccine. Both my mother and father have had the vaccine. My father, who is a Vietnam veteran, who has pre-existing health conditions. My mother, who also has pre-existing health conditions. Again, both of them well over the age of 75. My mother's going to hit me for that comment. But it really is one where we want to encourage folks to continue to do this. If I trust this vaccine for my mother and father, who I love, then I'm telling you that you should trust it as well. Please go and get vaccinated when it's your opportunity, when it's your time. I will definitely, when it's our turn, for my age group, certainly go and get vaccinated. And so I look forward to doing that. And we are going to continue to fight for you to make sure that we can get more vaccines so that we can put them in the arms of all the folks here in Montgomery County who need to have the vaccination and who want to get that done. So again, thank you to all of you for being on the call. Please, if you have any questions, feel free to reach out to my office. Just type in Craig Rice in Google. My office numbers will come up. I'll put it in the chat as well, but I look forward to continuing to work with you to ensure that we can have true health equity here in Montgomery County. So thank you, guys.
Thank you, Councilmember Rice. Up next is Councilmember Will Jawando.
Thank you, Tiffany. Thank you to Dr. Verdun and Dr. Kroll and Dr. Gales, and to my colleague and partner, Councilmember Rice, and to the county executive and everyone who participated. You saw compelling evidence. We've got to get this vaccine to everybody. You saw why, with the life expectancy, with the pre-existing conditions and the social determinants. You heard about our strategy, about how we're trying to get it to folks who are in need. We're taking it to them. We're using the outreach census team. We're going to go door to door. I think there's more we can do there. We're going to reevaluate as we move along our criteria, understanding that the state is moving differently. We're going to keep pushing with your help, the governor, for a mass vaccination site, for more vaccinations, and for an equity framework for the ones that they're giving to the private sector. We're going to keep working and trying to model that we want to keep getting tested, keep social distancing, and keep our facial coverings, all those things that we need to do to limit transmission. I'm glad Councilmember Rice mentioned the testing. We set up, the two initiatives, an African-American health program initiative, a Latino initiative, to make sure that we are getting testing, preventative PPE, and other information into communities. We're going to keep that going. This is a long fight here. This is not just something that's going to be over. We still have the variants on the horizon. So I think the worst thing we could do is to fall into a false sense of security. But it's going to take all of these things in addition to the vaccination process to get this done. And so really, really appreciate everyone's contributions tonight. We will get back to you as soon as possible on questions that weren't answered. I'm very easy to find, Will Jawando, and I'll put my stuff in the chat as well, as far as our office number and our my email. So thank you. Have a good night. Stay safe, and appreciate everyone hosting this forum.
Thank you, Mr. Jawando. Lastly, our county executive, Mark Elrich.
So I hope everybody found this interesting and informative tonight. We really are trying to make sure that folks have access to information and know what the county is doing and understand the situation that we're in terms of trying to get the vaccines out there. We have told the state that we have sites available for mass vaccination, but I will say we've been able to put as many doses out to the sites we have without having a pre-designated site. We are fully prepared to get doses out in large quantities. We just need the doses to come here. In the meantime, it's important not only to get tested, but I think people have to set in their minds that we're going to be wearing masks for a while. I know Dr. Fauci said either this morning or yesterday that mask wearing is probably going to be important going into 2022. And I know that seems like a long time. The good news is that you probably won't get flu either. The bad news is that you'll be wearing a mask. But the truth is that even the vaccines don't give 100% protection, and they certainly don't give 100% protection against the new variants. And so we're going to want to make sure that we keep this as much under control as we can. I look at these numbers like pretty much every day and get briefed, every, 3 times a week on this directly. And throughout this whole episode, the county has, done relatively well in terms of cases compared to many other jurisdictions, particularly cases per 100,000 and test positivity. And I attribute that to the fact that the residents here have been much more supportive of wearing masks and taking the safety precautions that we've asked, and also because the council supported executive orders where we kept the county more strictly controlled. We really wanted to make sure we minimized the human contacts that people were able to have, because we know that that is how COVID gets spread. It's this isn't something floating around in the air or multiplying through animals. You're not going to get it from mosquito bite. You're going to get it from coming close to another person. And so we've been very careful to make decisions that minimize the amount of exposure that people would have to each other, knowing that was the only tool we had in our toolkit that could actually keep the COVID cases down. And, from the beginning, the control of the COVID virus has been one of those things that what you do really makes a difference. People tell you all the time that what you do is really important. What we do is really, makes a difference. The truth is, with COVID, everything we do makes a difference. And it is truly, truly the reality of the situation. So we're going to keep working at this. We're going to hope for the new doses that will come from the new vaccines that are being approved that will bump up doses slowly at first, but eventually it'll give us another much larger pipeline. We'll get those doses out to people as quickly as we can. And as somebody else said, the pressure needs to be on the state to deal with this as an equity issue. We have raised it repeatedly. We've asked them to follow the same priorities we're following. I've been pointed with the governor and saying, you set out 1A and 1B as your priorities. When you make everybody eligible, there are no priorities. And if none of the other providers in Montgomery County are following your priorities, then it leaves it to the health department alone to do that. Well, we're doing that, and we're going to keep doing it. But it would be great if everybody who's distributing vaccines in the county was playing by the same rule book and following the same script. And your voices going to the governor might help persuade them that they need to take a more serious look at that approach. So again, thank you for letting me join you tonight. And thank you for all coming out and listening. I hope you learned something useful.
Thank you all. I am going to ask Dr. Verdun, we have just a little bit of time, to talk to us a little bit about the outlook for future vaccines. I'll reiterate what I said earlier. Believe it or not, we were just 7 months ago talking about how to avoid getting COVID, how not to infect your families. And now we're sitting here talking about the vaccine. And I know it feels slow to us, but this is really warp speed in real life, right? And so I think Moderna and Pfizer vaccinations getting into arms in this country, in this community, is life-saving. But, we're hearing talks of the Johnson & Johnson vaccine and the other vaccine that you've spoken to us about. If you could just give us a quick outlook about what we can look forward to maybe 6-7 months from now, as we continue on what seems like a very long COVID-19 journey.
So there are multiple vaccines that are in the pipeline and that are continuing clinical trials. And so as those trials mature and that data is submitted to the FDA and reviewed, we hope to add to the amount of vaccines that are available. In addition, we continue to work with both Pfizer and Moderna to ramp up their manufacturing capacity and to make sure that we ensure a product that's consistent And so we have a lot of things that we're working on and working through. And we realize, as a partner in all of this, that access to vaccine is definitely important. And at FDA, we're doing our piece to try and encourage vaccine development and to help in the process. So I do think that months down the line, we'll be in a different situation, certainly. And I think there will potentially be more things available.
Thank you for that. Cause for optimism, of course. We know as time goes on, things will get better, as they have already gotten better for us. I want to take this time to thank the whole panel, Dr. Crowell, Dr. Gales, our elected officials, and of course our guest, Dr. Verdun, all of whom have worked really hard over the last year to keep us safe, to keep us whole, and to make sure that we are all able to see the other side of this pandemic. I also want to remind the audience that we will put up the PowerPoints from Dr. Verdun and Dr. Crowell's presentations on our website. And I want to encourage you to help your neighbors, help your families, help your friends who do not have access either to the internet or to other means of getting registered for the county vaccine program. And I want to thank you for giving us your time for yet another town hall, for your questions, for your passion for this, and for continuing to hold us accountable as we continue to work to keep you safe. Again, my name is Tiffany Ward. I am the Director of the Office of Racial Equity and Social Justice, and it is always good to see these panelists. I feel like I see you guys every other month or so in one of these, and always glad to see the constituents and residents here taking full advantage of getting answers from us.
Hey,
Thank
Tiffany?
you so much. Yes,
Tiffany?
Yes, Councilmember Rice.
Yes, just very quickly, I just wanted to let folks know, because there was a question in the Q&A about schools. The Education and Culture and Health and Human Services Committee will be meeting on Thursday, February 25th at 3 p.m. to discuss with MCPS the plans for school reopening that will include and answer a lot of the questions that were mentioned in the Q&A today. So I just wanted to highlight that. And then later on that evening, also on Thursday, February 25th, we will be doing a vaccine town hall. And so that starts at 7 p.m. So similar to what we did this evening, there will be another town hall that's generic for the county council. And so just wanted to encourage folks to be aware of that as well. And please come and attend. There'll be an opportunity to answer, even get even more of your questions answered. So just wanted to put that out there.
We're here all week. We're here all week.
Thank you so much. I appreciate you all. Have a wonderful evening. Be safe.
Thank you.
Thank you.